Diabetes is a chronic condition that affects how your body uses sugar or glucose. This sugar is a vital source of energy for your body's cells, tissues, and organs. Hello everyone, and welcome to Dr. Elsa Victoria's channel. Today we are going to talk about a very important topic, diabetes. We'll learn about the symptoms, risk factors, prevention, and more. So, stay with us until the end. Diabetes is a chronic disease that can affect people of all ages. But what are the symptoms we should look out for? Some of the most common symptoms include increased thirst and frequent urination, extreme hunger, unexplained weight loss, constant fatigue, irritability, blurred vision, slow healing of wounds, and frequent infections such as gum or skin infections. I bet you didn't know the last one, right? Increased thirst and frequent urination are common symptoms, often attributed to the body's attempt to flush out excess sugar. Unexplained weight loss is another red flag, as the body may not be utilizing glucose efficiently. Increased hunger, even after eating, can be an early sign that cells aren't receiving the necessary energy. And fatigue and blurry vision are further indicators that something is amiss with the body's blood sugar regulation. While diabetes can develop at any age, certain types are more prevalent in specific age groups. Type 1 diabetes, often diagnosed in childhood or adolescence, is characterized by the body's inability to produce insulin. In contrast, type 2 diabetes, typically diagnosed in adulthood, is linked to insulin resistance or insufficient insulin production, although I must say that these days the diagnosis in children has increased. Several factors can increase your risk of developing diabetes. For type 1 diabetes, the factors are mainly genetic and autoimmune. If you have a family history of type 1 diabetes, you are at a higher risk. However, for type 2 diabetes, the risk factors include the ones which we obviously cannot modify: older age, family history of diabetes, and on the other hand, the ones that are in our hands, obesity. We are talking about body fat percentage and not just BMI. We are in 2024, everyone knows that, right? Sedentary lifestyle, unhealthy diet, high blood pressure and high cholesterol levels. What should you monitor in your body and diet to know if you are at risk? Early detection of diabetes is crucial for preventing complications and effectively managing the condition. While some symptoms are evident, others can be subtle and easily overlooked. Pay attention to your body fat, muscles and weight, blood glucose and blood pressure levels, especially if you have a family history, cholesterol levels, dietary habits and physical activity levels. Recognizing these early signs and seeking prompt medical advice can significantly impact long-term health outcomes. The million-dollar question: what should you do to prevent diabetes? At this point in the video, it might sound obvious, but I'm going to mention it to you. Maintain a healthy body fat percentage. Be aware of your body fat percentage. Remember, it is very important that what you do is sustainable over time. Exercise regularly. Follow a balanced and healthy diet. Do not smoke. Control blood pressure and cholesterol levels. And have regular medical checkups to monitor blood glucose levels. Finally, if you have diabetes or suspect you might have it, who is the specialist you should consult? The specialist for diabetes is an endocrinologist. This doctor specializes in the endocrine system and the glands that produce hormones, including insulin. These specialists are trained to manage all aspects of diabetes care, from diagnosis and treatment to ongoing management and support. And that's all for today. Thank you for joining me in this video about diabetes. If you have any questions or want to know more, feel free to leave us a comment. And don't forget to subscribe to my channel for more health content.